your baby is the most precious thing in your life. And that's why we're talking about the vitamin K injection that's given at birth. Guys, I'm Dr. Jen Caudle. It is good to see you. Now, we're going to talk about what the vitamin K injection is, what it does, why so many parents have been declining or refusing it, and what you need to know, okay? First of all, that vitamin K injection is not a vaccine, it's a vitamin. Vitamins I think of as pretty natural. It's a vitamin that we all need, but especially babies when they are born. And I'll tell you why. So vitamin K is what our body uses to make blood clots. Okay, so without enough of it, several of the proteins that help stop our body from bleeding don't work well. And what that means is that like a simple bump or an injury could lead to bleeding that just doesn't stop, very serious bleeding, especially in a newborn. So you're probably saying, well then, okay, well that sounds important, but why do newborn babies need vitamin K? And that's an excellent question. So basically, every baby is born low in vitamin K, and that's for a few different reasons. Number one, very little vitamin K actually crosses the placenta from the mom. That's no fault of the moms, no fault of the baby, it's just what is. Also, breast milk, which is amazing in so many different ways, does give your baby a little bit of vitamin K, but it's not enough to prevent some of the consequences of not having vitamin K in infants, which we'll talk about, vitamin K deficiency bleeding. Hold that thought because we're going to get there. And the third reason is that gut bacteria that really eventually help make vitamin K haven't really moved in your baby and haven't started working, right? Haven't started like getting to work, okay? And that's why we're talking about it. Look, I know a lot of parents are concerned. They might have heard lots of different things. And they may say, well, gosh, do we even need this? Well, the thing that we worry about is vitamin K deficiency bleeding. Remember I mentioned that a few moments ago. This is the thing that can happen in babies, infants that don't have vitamin K injections. It can happen, this vitamin K deficiency bleeding can happen day one, it can happen in the first week, it can happen weeks to months later, out of the blue, in a baby who's actually looked completely healthy. Yeah, and that form, that late form, in that form, more than half of the babies actually bleed into the brain. Some are left with permanent brain injury. Some even die. This is why we're so concerned about it. And moms and dads and parents out there, if you think that you'd be able to tell if this was going on, you stand corrected because oftentimes there are no warning signs at all. Without a vitamin K shot, babies are 81 times more likely to develop vitamin K deficiency bleeding. And 1 in 5, 20% of babies who develop vitamin K deficiency bleeding will die. This is why we're talking about vitamin K. The good thing is, one vitamin K injection prevents almost all of that. You know, the American Academy of Pediatrics, by the way, go to their website, it's amazing, and they talk a lot about this too. They recommend a single 1 milligram shot into the thigh for every baby within 6 hours of birth. Now, very small premature babies will get a weight-based dose, and listen, this shot takes just seconds, but it provides protection for months, and that's what we need. So now let's talk about some of the concerns that I know parents have. And we're talking about it because, look, your questions are real and valid, so let's get some answers for you. Refusal is actually rising. In Sweden, the share of babies not getting the shot has more than doubled since 2006. And bleeding diagnoses in infants has risen along with it. And then, of course, in parts of the United States, refusal now reaches about 5%. A lot of my doctor colleagues are talking about this. That's why you and we are talking about this. So let's talk about some of the reasons why parents may be concerned about their child getting this injection. One reason is a parent might say, well, gosh, I've never heard of this. Is it really necessary? Do we really need to do this for our baby? Now, this is probably one of the more common reasons parents might refuse it, and it's completely understandable because the shot actually works so well that almost no one sees the disease anymore. Thank goodness for that. Vitamin K deficiency bleeding is rare today only because we prevent it with the vitamin K injection. Not because that risk went away, because it didn't. It's because we prevent it. I would say number two is some parents say, well, my baby is healthy. My pregnancy was normal. I'm healthy. My baby doesn't need this. Understandable to think that way, but the thing about it is, it's important for me to say that being healthy is not protection against vitamin K deficiency bleeding. Another thing parents will say is they'll say, I want a natural birth without interventions. And I get that. But think of it this way rather. Vitamin K is natural. It's a vitamin, okay? It's not a vaccine. It's not immunization. By the way, those are safe as well. But it's vitamin K, the same vitamin that's found in leafy greens. We just give it at the moment your baby can't get it another way. Another thing parents say is they may say, well, I don't want my baby to be in pain. And gosh, I understand that. But remember, it's just a few seconds of crying, a little bit of discomfort, okay? There are ways to certainly soothe your baby, but that moment of discomfort is going to provide them life-saving protection, okay? You want to weigh those odds. Some parents may say, well, it has a preservative in it. Well, the preservative is benzyl alcohol. It's in a tiny amount. There is no evidence that it causes harm at this dose, okay? So preservative-free vitamin K is also widely used. So if that's your concern, just make sure you talk to your doctor, your child's pediatrician about it. Another thing is some parents say that they read it causes childhood cancer. Now, this actually comes from one small British study in 1990. But since then, much larger studies in the United States, Scotland, and a pooled analysis of more than 2,000 children with cancer have looked for that link and not found convincing evidence of it. And major reviews conclude that vitamin K is not associated with leukemia or other childhood cancers, which is very good news. Once again, pointing out the safety of this vitamin K injection. And then the last thing probably is that a lot of parents will say, well, gosh, somebody I trust, someone I look up to told me to skip it. And it's true. Friends, social media, celebrities, lots of people out there, oftentimes spout misinformation. You want to talk with your doctor, your child's pediatrician, about what the facts are, what really is real and what is not. Talk to your doctor, your child's pediatrician about the evidence, the data, etc. This is really, really important. So look, I understand your questions, and I have no problems with you asking questions. In fact, I think asking questions can be quite healthy. But the thing is, you have to understand, and I really want you to understand, that vitamin K injections are very, very safe and effective. Now, some parents may ask for oral vitamin K instead of the shot. The issue with this is that babies can't absorb the oral form very well, so it doesn't work well to prevent vitamin K deficiency bleeding. The vitamin K shot really is the safest and the best options for all newborns. So, as I always say, our goal is to keep you healthy, and your goal is to keep your baby healthy. Make sure you talk to your child's pediatrician about any and all questions that you have. If you're pregnant, talk with your OB, talk with your doctor about any and all questions that you have. Just understand that one shot, a few seconds, literally can save a life. So I was editing this video and I realized I did not ask you a question I really want to know, which is, did you get your infant the vitamin K injection or did you not? Please write in the comments, write why yes, why no, and any factors that went into your decision. I think it would be really interesting and important to hear. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I create daily videos on all sorts of stuff. Please like and follow my page on Facebook. Please subscribe to my channel on YouTube. I'm on Instagram, TikTok, LinkedIn, WhatsApp, all the good things. I'm Dr. Jen Caudle. Please sign up for my free health newsletter at drjencaudle.com. I'll see you soon.